Now I will be discussing about the topic for scapular region. And for this scapular region, first you have to understand where is exactly the location. It is the upper part of the posterior surface of the trunk. See, in the posterior we have the anterior surface and the posterior surface of the trunk. In the posterior surface, the upper part is on the right side and the left side. That is called as the scapular region. That is around the scapula, simply to say. And in this scapular region, first we will discuss about the skin details and its fascia. Next, we will discuss about the muscles. Now, what about the skin importance is the skin cutaneous supply is actually supplied by dorsal ramus. Dorsal ramus gives the cutaneous supply. Now, question is which part of the dorsal ramus, whether it's the medial branch or the lateral branch. Up to T6. It is the medial branch of the dorsal ramus will give the cutaneous supply, and below the level of T6 it is the lateral branch of the dorsal ramus that will give the cutaneous supply. So dorsal ramus has medial branch and the lateral branches. The medial branch will supply to the top as a cutaneous supply up to the level of T6, and below, that is T7 to further below, it is by the lateral branch of dorsal ramus. So all are supplied by dorsal ramus only, whether it is the medial branch or the lateral branch, that is the only difference. Now coming to the fascia, it will be more thicker when compared to that of the anterior region. That's nothing extra to be remembered regarding the fascia. Next, coming to the groups of muscles. Muscles are divided into certain groups. In that, the first group of muscle is axio-appendicular. Axio-appendicular group of muscles. And another is scapulohumeral vessels. Humeral muscles. Axio-appendicular. That means the muscles are extending from the axial skeleton towards the appendicular skeleton. That's why the muscles is given as axio-appendicular muscles. Now these axio-appendicular muscles are arranged in two layers. One is the superficial layer and the deep layer. What are the muscles present in the superficial layer are trapezius and the latissimus dorsi. Trapezius and latissimus dorsi. What about the deep? Deep consists of levator scapulae, rhomboidus minor and rhomboidus major. Okay, so muscles are divided into two groups. One is coming from the axial skeleton towards the appendicular skeleton. They are called as axio-appendicular group of muscles, arranged in two layers, the superficial and the deep. A superficial layer consists of the trapezius and that of latissimus dorsi, whereas the deep layer consists of levator scapulae, rhomboidus minor and rhomboidus major from superior to inferior. What about the scapulohumeral vessels? So first discuss about this group of muscles, then we will shift to the top scapulohumeral muscles. Okay. First, trapezius. First muscle we will be discussing is trapezius. Now, what is the origin? What is the insertion? Nerve supply and actions. Any muscle, these are the things you have to remember. Let's draw. This is the base of the skull with its vertebra on the posterior side, and this is a scapula. It is a posterior view. Okay, this is a scapula with its suprasternal arch coracoid process on the posterior view, and this is the acromial process from the spine, and further anteriorly we have the clavicle. Where the origin of these trapezius is, we have a line called as a superior nuchal line. Nucha means neck. At the level of the neck, there is a line at the superior part. That's why there is a superior nuchal line. In that, only the medial part of the superior nuchal line will give the origin for trapezius. The second one is, so this is the medial part of superior nuchal line. And the next one is a protuberance in the midline that is called as external occipital protuberance. That is also a origin for the trapezius. And from that external occipital protuberance towards the entire cervical vertebra, there is a ligament. From that ligament, the origin will be present. That is called as ligamentum nuchae. Nuchae means neck. In the neck it is present. That's why it's called as ligamentum nuchae. From this ligamentum nuchae also it will take the origin. And this ligamentum nuchae is present throughout the cervical vertebra. Next, after that, the T1 will be starting the first thoracic vertebra. And let's imagine here is the T12 vertebra. So this trapezius will originate from T1 to T12 vertebral spinous process. T1 to T12 spinous process. This is the origin. First is the medial part of superior nuchal line, external occipital protuberance, ligamentum nuchae at the level of cervical vertebra, and the entire thoracic vertebra posterior most part, that is the spine. This is the origin. And these fibers are divided into three groups. Some fibers will be radiating towards the lateral end of the clavicle. So here is the lateral end of the clavicle. So these fibers will be radiating towards here. Next is the medial border of acromion process, where the middle group of fibers will be going to that of medial part of the acromion process, whereas the lower fibers will be inserting on the upper border of spinous process. So this is the fibers which is going here. Will go and insert on the upper border of the spinous process. So this is what the extension of trapezius. So this is on one side. The same side, on the other side also it will be like this, that gives a trapezoid shape, and hence the name of trapezius is given. Okay, so on one side it is triangular, on both triangles if you combine as a trapezius. So insertion is lateral 1/3 of the clavicle, medial border of acromion process, and also the superior border of spinous process of the scapula. Okay, so this is the origin of medial superior nuchal line, external occipital protuberance, ligamentum nuchae, and T1 to T12 spinous process, whereas the insertion is lateral 1/3 of the clavicle, where the upper fibers are there, and the middle fibers will be inserting to the medial border of the acromion, and the lower fibers are attaching to the top superior border of the spinous process of scapula. Now what about its nerve supply? A nerve supply is by spinal accessory nerve. Spinal accessory nerve. This is a motor, but the proprioceptive fibers is taken by C3, C4. C3, C4 spinal nerves will take proprioception fibers. That's called as proprioceptive fibers. And what is its action? Upper fibers, middle fibers, and the lower fibers. Upper fibers will cause the elevation, that is called as shrugging. Like this movement is called as shrugging of the shoulders. Elevation of the shoulders. What about the middle fibers? Middle fibers will retract the scapula like this. This is called as retraction of the scapula. Retraction of scapula. Whereas the lower fibers cause the scapula to drag downwards. So downward drag of scapula. So just like this. Okay. This is back, that is a retraction. If you move down, that is called as the lower, that is by the lower fibers of trapezius. So upper fibers of trapezius is stretching, lower fibers of trapezius is depression, and retraction is by the middle fibers, retraction. So this is the three movements by the three different groups of trapezius. Okay, origin, insertion, nerve supply, and action. So that's about the trapezius muscle. The next major muscle in the superficial compartment itself, that is the latissimus dorsi. Okay, latissimus dorsi. Where does this latissimus dorsi is? Again, let's draw the latissimus dorsi. Let's draw the base of the skull in the posterior view, and these are all the cervical vertebra, and here is, let's imagine T1 vertebra that is started and ended at T12, and this is the lumbar. Just lateral to the lumbar there is a structure called as iliac crest. Iliac crest. The upper part of the hip bone is called as iliac crest, and this is the posterior 1/3 and this is the anterior 2/3 of the iliac crest. Just remember that. And here is the scapula with its borders on all sides and articulating with that of the humerus. Scapula, humerus, skull. This is called as the iliac crest. Now where the fibers are originating for the latissimus dorsi is from the thoracic vertebra on the lower side and between the and also the posterior 1/3 outer lip of the iliac crest. So origin is thoracic vertebra spinous process. Thoracic vertebra spinous process and outer lip of posterior 1/3 iliac crest. And connecting this lower part of the thoracic and the iliac crest, there is a attachment for which it originates called as thoracolumbar fascia. So it originates from a fascia called as thoracolumbar or lumbar fascia. From these, and some fibers will be originating from the inferior angle of scapula and partly from some of the ribs here, from the lateral sides of some ribs. From all these fibers, so total 5 origin. This is the inferior angle of scapula and these from the ribs. So this is the origin for the latissimus dorsi. And where does it insert is, when we had discussed about the axilla, we had said latissimus dorsi is inserting in the bicipital groove. Let's imagine this is the bicipital groove which I am representing in dots because it's present on the anterior side. Now whatever we are seeing on the posterior view, so that's why I can represent it as dots. So fibers from these, they will be going and insert here. From all the origin points, it will be inserting towards that intertubercular sulcus or the bicipital groove. So insertion is the bicipital groove. Bicipital groove. And while inserting, these tendons will be shifted where the upper fibers will become lower and the lower fibers will become upper and then inserts. That's about this latissimus dorsi. So origin is inferior angle of the scapula, ribs, thoracic vertebra spinous process, and from also thoracolumbar fascia and outer lip of posterior 1/3 of the iliac crest. Whereas insertion is towards the bicipital groove. Then what about the nerve supply? Nerve supply is by thoracodorsal nerve. Thoracodorsal nerve. Coming to the actions of latissimus dorsi, that it causes, when the latissimus dorsi is coming from the posterior end, so whenever it causes contraction, then the upper limb will be going posteriorly, that is called as an extension. and if it drags medially, because from origin fibers are towards the medial and insertions towards the lateral, so whenever the contraction is there, it drags the upper limb towards the medial side. That is called as adduction, and it causes slight medial rotation also. So it has three things: extension, adduction, and the medial rotation. And this is a large muscle that is extending throughout the dorsal part. That's why it's called as latissimus, the widely spread on the dorsal side, dorsi. A widely spread muscle on the dorsal side. That's why it's called as latissimus dorsi. And this muscle is has a nickname called as a coughing muscle. Coughing muscle. See, for the cough, there has to be a violent contraction of the muscle. So one of that violent contraction of the muscle is by this latissimus dorsi, causing the rise of intra-abdominal pressure, the coughing muscle. That's why the latissimus dorsi is called as coughing muscle. And what is the clinical anatomy related with latissimus dorsi is, latissimus dorsi has a specific blood vessel that is called as thoracodorsal artery. Blood vessel called as thoracodorsal artery, which will as a specific supply to latissimus dorsi. Now, this muscle and this vessel is used in breast reconstructive surgeries. Whenever there is a reconstruction of the breast at that level, this is used. Breast reconstructive surgeries. So for these breast reconstructive surgeries, silicone implants or these thoracodorsal flaps are also used. Okay, and it also acts as a cardiac muscle. Why it is acting as like a cardiac muscle? It has a many features. Latissimus dorsi has a many features like the cardiac muscle. So whenever there is a damage of this cardiac muscle, then this latissimus dorsi is used in place of that. Why? Because it is non-fatigable, first thing, and second thing, it constantly uses a pace of oxygen. Pace of oxygen usage is at the constant level. Because of these two reasons, it can be used as a replacement of this cardiac muscle. Once the superficial group of axioappendicular muscles are completed, then we will be shifting to the top deep group. So what are the muscles that are present in deep group are? The first one is levator scapulae. Second one is rhomboides major. The third one is rhomboides minor. So these are the three muscles from superior to inferior in the second layer of axioappendicular muscles. So let's discuss about all these origins, insertions, now supply, and the actions of each. First is levator scapulae. Levator scapulae. Let's draw the base of the skull on the posterior view. And these are the spinous projections from C1, C2, C3, C4, C5, C6, C7, T1, T2, T3, T4, T5, T6. And this is, here is C4. This is C7 and T1, T2, T3, T4, T5. Okay. These are all the projections of the spines on the posterior side, called as spinous projections. And I am giving only the transverse process of C1 to C4. Why? Because levator scapulae actually originates from the transverse process of C1 to C4. Okay, so this is a transverse process. Transverse process. So if you draw about the scapula, this is the scapula, the superior border having the projections. So this is how the scapula is present. Now where is the origin of levator scapula is the tips of the transverse process of C1, C2, C3 and C4 vertebra. So origin of levator scapula is tips of transverse process for C1 to C4 vertebra. From that, where the fibers are going and insert is, it is the medial border of the scapula just above the level of spinous projection. This is the spinous projection. So on the medial side above the spinous projection will be the insertion of levator scapula. So the fibers will be radiating like this. So this is a origin and insertion in the medial border of scapula above the spinous process. Now where is the nerve supply? What is the nerve supply for the levator scapula is? It is C3 and C4 direct branches. There are direct branches from C3 and C4, but there is another branch which is supplying for C5, that is a dorsal scapular nerve. So dorsal scapular nerve, which is a branch from the brachial plexus, will be supplying to the top levator scapulae. But it also receives the direct branches from C3 and also C4. And what are the actions? That levator scapulae, it elevates the scapula. Elevation of the scapula is a function or action of levator scapulae, the first muscle of second layer, right? Now after the levator scapulae, now we will be discussing about rhomboides minor. Now this rhomboides minor originates from C7 and T1 tips of spinous process. Levator scapulae is from the tips of transverse process. Now I am talking about rhomboides minor. So in the rhomboides minor, it is from the junction of cervical and thoracic vertebrae. So what is the cervical vertebra? It is a C7. And what is the thoracic? First is a T1. So at these two spinous process projections, the origin will be present. Next is rhomboides minor. Where is the origin? It is spinous process of C7 and T1. So from these is the projection. Where it will get insert is at the level of spine. At the level of spine of scapula on the medial border. On the medial border. For example, somewhere here. So the fibers will be radiating like this. That's the rhomboides minor. And what about the rhomboides major? It is from the tips of spinous process of the next vertebral levels. So what are the tips of transverse process of next vertebral levels? T2, T3, T4 and T5. The next four tips of the transverse tips of the spinous process will be the origin of rhomboides major. And where it inserts is along the medial border of the scapula below the level of spine. So one is above the level of spine, and the second one is at the level of spine, and the third one is below the level of spine. So these fibers will be radiating like this. That's the rhomboides major. So rhomboides major origin is the spinous process of T2 to T4. And where is the insertion? It is medial scapular border or medial border of the scapula below the spine, below the level of spine. Now what about the actions and nerve supply of these rhomboides major and minor is, nerve supply is dorsal scapular nerve, the branch of the brachial plexus, and actions are it causes the retraction of scapula. The retraction of scapula. You know that middle fibers of the trapezius muscle also causes the both the scapula to retract. This is a retraction. Okay, so the same is why it's also assisted by the rhomboides major and rhomboides minor. See, these nerve supply and action is for both rhomboides major and also the rhomboides minor. So that's about the second layer of muscles that are present in the axio-appendicular group. Now coming to, so axio-appendicular group, first layer is completed, second layer is completed. Now we will be shifting to the top another group of muscles which is attaching from the scapula to the humerus, called as scapulohumeral muscles. So the next group that we are presenting here is scapulohumeral muscles. Scapulohumeral group of muscles are present. In that the major muscle first is deltoid. Let's draw scapula here. And this projection is called as the spinous process, which ends as the acromion process. An acromion process will form a junction or a joint with that of the clavicle. So this is the clavicle, this is the acromion, and this is the spinous process of scapula. And is the articulation of the humerus somewhere here. It should be downwards. Now the origin of deltoid is along the anterior border of lateral part of the clavicle, and that continues along the lateral border of the acromion process, and further continues as the lower border of the spinous process of scapula. So three origins are present for that of deltoid. First is the anterior border, where on the lateral side of clavicle, on the lateral side of the clavicle, anterior border. Next, another side is the lateral border of acromion process, and finally the lower border of spinous process of scapula. Spinous process of scapula. So this is the origin. And where does this go and insert is, there is a tuberosity present in the humerus that is called as a deltoid tuberosity. That will be the insertion. Deltoid tuberosity. Okay. So origin is having three, whereas insertion is having only one thing. And the fibers will be radiating in this manner towards this radial tuberosity. Deltoid tuberosity. So this is about the deltoid. And this deltoid having three fibers. One is originating from the clavicle, that's called as clavicular fibers. One originating from the acromion, called as acromion fibers. And originating from the spinous process, they are called as scapular fibers, or the spinal fibers. So out of these three groups of fibers, the fibers which are originating from the acromion process are multipinnate. Okay. So those fibers which are coming from the top acromion process, these are multipinnate group of muscles. And what is the nerve supply? Nerve supply is by the axillary nerve. Coming to the actions, these actions, there are three groups of fibers are there present in the deltoid. In that, the anterior group, which is coming from the clavicle, has three functions. One is it causes the upper limb to come towards the front side, that is called as flexion. It causes the upper limb to turn towards medially, that is called as medial rotation. And it causes the upper limb to come towards the midline, that is called as adduction. So anterior fibers, that is confirming on the clavicle, it causes abduction, flexion, and also medial rotation. Whereas posterior fibers, exactly opposite. That first initially it causes abduction, but as the fibers are dragging towards posterior side, that is called as an extension. It causes the upper limb to turn towards this side, that is called as the lateral rotation. So these are the functions for the posterior fibers. And the middle fibers, which are coming from the acromion, they cause abduction, moving away from that of the midline, abduction of the upper limb. From which to which degrees? That's also specifically needed. That is from 15 to 90 degrees. Sir, what is after 90 degrees? What is before 15 degrees? We will discuss about that. As of now, the abduction level is for the deltoid is from 15 degrees to that of 90 degrees. Okay. This is what regarding the first muscle, the deltoid. Next is, once you remove the deltoid, we can see certain groups of muscles. In that, the first group of muscle we can see on the ventral side of scapula. Let's see, this is a ventral view of the scapula. And this is a glenoid cavity with its inferior angle. So whatever you are seeing is a ventral view. Okay, I'm writing here ventral view. And what is the muscle we are discussing is now subscapularis. And here is the head, the humerus. So this is the ventral view of the scapula and of the humerus. Now from this ventral surface, from this entire region, there is a origin of subscapularis. From there, the fibers will be going and insert over that of lesser tubercle. The fibers will be radiating in this manner. And they are crossing the shoulder joint from the front side. Okay. So origin is the ventral surface of scapula, that is called as subscapular fossa, simply to say. That fossa is called as subscapular fossa. From that subscapular fossa, the origin of the fibers are taking place. And from there, they cross the midline point, they cross the shoulder joint on the anterior side and then insert over the lesser tubercle. So this is the origin insertion. And what is the nerve supply is? Nerve supply is by two nerves. One is upper subscapular and also lower subscapular nerve. So upper subscapular and lower subscapular both are actually the branches from the posterior cord of brachial plexus. And these two will supply that of upper part and the lower parts of subscapularis muscle respectively. And what are the actions is, as it is crossing that of the shoulder joint on the anterior side, whenever the contraction is there, it causes the medial rotation of the shoulder joint. So the action is the medial rotation. This is about the second muscle in that scapulohumeral group. This is on the ventral side of the scapula. What about on the dorsal side of the scapula? What are the muscles that are present? Is first, this is the dorsal view. And this is the humerus with its greater tubercle. And greater tubercle has three impressions. Please remember what are those three impressions. I will discuss that. And here is the spine of scapula. Now just above the spine of the scapula, the fossa is called as supraspinatus fossa. And from that supraspinatus fossa, the origin of supraspinatus muscle will be present. And from there, it will be going and insert over to the top the upper impression on the greater tubercle. This is a supraspinatus projection. So supraspinatus, origin is supraspinatus fossa. And from there, the insertion is towards the upper impression on the greater tubercle. There are three impressions we had said. So upper impression on the greater tubercle will be the insertion for that of supraspinatus muscle. And what is the nerve supply is the suprascapular nerve itself, which is coming from the upper trunk of brachial plexus. Just go back to brachial plexus where the suprascapular nerve is coming. And action is that as it is crossing the shoulder joint from the superior end, so whenever it causes the whenever the contraction is there, it causes the abduction of shoulder joint. So now we are saying here again abduction, just like deltoid, this is also abduction, but what to what angle is, it is from 0 to 15 degrees. So abduction of the shoulder joint from 0 degrees to 15 degrees is by supraspinatus. We had said 0 to 15 degrees, from 15 to 90 is actually deltoid, but what about below the 15 degrees, that is from 0 to 15, it is by supraspinatus. Initiator of abduction is supraspinatus and the continuation will be taken over by deltoid, right? That's about the supraspinatus. And just below the spine, there is a fossa called as infraspinatus fossa, and from that infraspinatus fossa, the fibers will originate, that is called as infraspinatus muscle. So infraspinatus muscle is origin infraspinatus fossa, and insertion. Where does this insert is? It will insert on the middle impression that is present on the greater tubercle. So like this, it will be going on the posterior side of the shoulder joint. So middle impression on greater tubercle. And what about the nerve supply is, it is also supplied by the same nerve, that is the suprascapular nerve. And whenever the contraction is going behind the shoulder joint, so whenever it contracts, it causes the shoulder joint to rotate laterally. It's a lateral rotation of shoulder joint. Why is lateral rotation? Because it is contracting from behind that of the shoulder joint. So it is a lateral rotator of shoulder joint. That's about the second muscle in that dorsal part of scapula. Now there is a lower impression, and over that lower impression there is a muscle called as a teres minor, which has two slips of origin. Teres minor. Origin is on the lateral border of dorsal surface. This is the lateral border, right? And whatever you are seeing on the dorsal view or the posterior view. So origin is on the lateral border of dorsal side in the scapula. From there, these fibers will be radiating and insert over the lower impression of greater tubercle, like this. So insertion is the lower impression on greater tubercle. And what is the nerve supply? The nerve supply to teres minor. Usually people confuse at this level what is the nerve supply of teres minor, what is the nerve supply of teres major. Usually confusion is the teres minor and teres major, whether it is what's the nerve supply and what is where the axillary artery ends, like that. So nerve supply for teres minor is same as deltoid, that is axillary nerve. Axillary nerve. And this is also crossing from the posterior part of the shoulder joint, so the action is the lateral rotator of shoulder joint. And finally, one more muscle is present, that is teres major, and this teres major will be in the lower lateral border of dorsal surface and also the entire inferior angle of scapula. From there, the teres major originates. Next muscle is teres major. Origin is the lower lateral border on dorsal surface of scapula. Plus, it also originates from the inferior angle on the dorsal side. So that's the origin of teres major. Next, what is the insertion is, when we had discussed axilla, the teres major inserts upon the medial tubercle of bicipital groove. Yes or no? The medial lip of the bicipital groove, which is present towards the anteromedial side. So these fibers will be migrating towards the anteromedial side, and I'm giving dots because it's going on the anterior side, and then inserts over the medial tubercle. So insertion is medial tubercle of bicipital groove or intertubercular sulcus. And what about its nerve supply is, the teres major is supplied by the lower subscapular nerve. Lower subscapular nerve, and action is, teres major is not going the shoulder joint behind. It is crossing the shoulder joint from inferior side and inserting on the anteromedial side. The medial tubercle is towards the anteromedial side. So whenever it contracts, the anteromedial side will be dragged posteriorly so that the humerus will rotate on the medial side. So it causes the medial rotation of the shoulder joint. It is the medial rotator of shoulder joint. So the action of teres major is the medial rotator. Why it is medial rotator? Because it is inserting towards the anterior to the axis of this humerus. You have the central part of the axis of the humerus, and anterior to that axis it is inserting by crossing below the shoulder joint. So whenever it contracts, it causes the medial humerus to rotate on the medial side. This leads to medial rotation. So these are all the muscles that are present underneath the top of deltoid. So in the scapulohumeral muscle, first we had discussed deltoid, and if you reflect the deltoid, these muscles you will see. There is the subscapularis, supraspinatus, infraspinatus, teres minor, and teres major. Out of these, some group of muscles will be together insert towards the fibrous capsule. It blends with the fibrous capsule of shoulder joint to form a structure called as rotator cuff. Rotator cuff. Okay. So let's see what is rotator cuff muscles. Rotator cuff. Rotator cuff is actually formed by ventrally the subscapularis, superiorly supraspinatus, and posterior to shoulder joint it is infraspinatus, and also teres minor. It is not major, teres minor. All these tendons, that means the subscapularis is inserting over the lesser tubercle, whereas supraspinatus, infraspinatus, and teres minor are inserting over the three impressions of greater tubercle. So these all together fuse with that of the fibrous capsule of shoulder joint. Fuse with fibrous capsule of shoulder joint. So what is the importance of this fusion means? It forms a protection for the shoulder joint. See, anteriorly it is fusing, superiorly it is fusing, posteriorly it is fusing. Anteriorly subscapularis, superiorly the supraspinatus, and posteriorly the infraspinatus and teres minor. Right? So it's just covering that of the shoulder joints from anterior, superior, and posterior, but not on the inferior side. Because of this reason, the shoulder joint commonly dislocates on the inferior side. That means inferior dislocation of shoulder joint is more common because there is no support of rotator cuff. So where is the rotator cuff is supporting? Anterior, superior, and the posterior, and there is no on the inferior side. If there is no on the inferior side, then automatically that must be the weak point, and wherever is the weak point, there the shoulder joint dislocates, where the humerus will dislocate from the glenoid cavity of the scapula. That leads to inferior dislocation. So most common dislocation of shoulder joint, inferior dislocation. Why? There is no rotator cuff support on the inferior side. That's about the rotator cuff. So please remember these muscles. Again, there will be confusion between the teres minor and the teres major. I am specifying it is teres minor but not teres major. Teres minor will form the rotator cuff but not the teres major. Another confusion of the teres minor and major is regarding the nerve supply. Which nerve will supply to the top which things. So after the rotator cuff muscles, now we will be discussing about the intermuscular spaces. So between one muscle to other muscle, there is some spaces, and these spaces are present in the scapular region. So the heading now here is apt for intermuscular spaces in the scapular region. The intermuscular spaces in the scapular region. Now, what are those intermuscular spaces? Which forms the which boundaries? Let's see. Let's imagine this is a posterior view of the scapula with its projections here. This is the posterior view, okay? This is the inferior angle. And somewhere here is the humerus. I'm keeping slightly in abducted position for your better understanding. So in this, the first muscle we will draw is the teres minor. From this position, it will be going to the top lower impression of greater tubercle. This is teres minor. And just below this teres minor, there is another muscle, that is teres major. So teres major extension is like this. This is teres major. And one more muscle, that is the head of triceps, long head. So that long head actually originates from the infraglenoid tubercle. So from this infraglenoid tubercle, it will be coming down over the teres major. So let's imagine this is a triceps long head, and these are the muscles. So one is a teres minor in the upper part, teres major in the lower part, and this is a long head of triceps. So long head of triceps. So if you see this area, can you see a triangle shaped structure? And here also there is another area which appears a triangle shaped structure. So there are two triangles are present. One is upper triangular space and another is lower triangular space. Upper triangular space and another is a lower triangular space. Just lateral to this upper triangular space, can you see a four-sided area? That is called as a quadrangular space. Quadrangular space. So let's discuss about the boundaries for all these spaces. For this upper triangular space, what is present superiorly? It is teres minor. And what is present inferiorly? Teres major. And what is present on the lateral side? This is called as the long head of triceps. This is the long head of triceps. Now, whereas in the lower triangular space, superiorly we have the teres major. This is the teres major for superior, and inferiorly we have the long head of triceps. Long head of triceps. And what is present on the lateral side? It is a shaft of humerus. The shaft of humerus. This is for the lower triangular space. Now coming to the quadrangular space, what is present superiorly is teres minor and inferiorly is teres major. Superiorly is teres minor and inferiorly is teres major. And what is present on the medial side? Long head of triceps. A long head of a triceps. And on the lateral side, this neck is called as actually the surgical neck of the humerus. Surgical neck of humerus. So these are the boundaries. Now what are the contents in that spaces? If the space is present, what is the importance of these spaces is whatever the structures that are present inside that of the axilla, they has to enter the posterior direction also. So for that posterior direction, it is covered entirely by muscles. There is no output or no exit for that. So there are certain spaces which acts as exit. So if that exit means some structures has to come out of these spaces from the inside that of the axillary region. So what are the structures that are coming out is the first one in the upper triangular space, one branch called as the circumflex scapular artery. This is circumflex scapular artery. So the contents of upper triangular space is circumflex scapular artery. It is actually a branch from subscapular artery, which is a third part of axillary artery branch, the largest branch. Okay, so the subscapular artery will descend along the lateral border of the scapula. While descending, it will give a branch which will winds around the scapula. That's called as circumflex scapular artery. So that's about the content of upper triangular space. Now the content of lower triangular space is one nerve which comes in this direction to along the radial groove. So that nerve is called as radial nerve. And one more vessels, that is profunda brachii vessels will be going. That means both artery and the vein will come out through this lower triangular space. So here the contents are radial nerve and also profunda brachii vessels. That means both artery and vein. That's the content of lower triangular space. Coming to quadrangular space, and in this quadrangular space, what is related with that of the surgical neck of the humerus is, one is the axillary nerve which winds around this, and also posterior circumflex vessels. Posterior circumflex vessels. The contents are axillary nerve, posterior circumflex artery and vein. So this is the contents of different intermuscular spaces that is present in the scapula. Okay, intermuscular spaces, in between the muscles there is a spaces. Why the spaces has to present? Whatever the structure that is present in the anterior axilla, that has to come out on the posterior side also to supply. So for that there has to be some exit points. So these are acts as the exit points for continuation of the posterior structures to come out. And what are those? We had seen that in the upper triangular space is the circumflex scapular artery. In the lower triangular space it is profunda brachii vessels and also the radial nerve. And whereas in the quadrangular space it is the posterior circumflex vessels and also the axillary nerve. So these are the contents of this corresponding. So in all these spaces, in two spaces, that is lower triangular space and quadrangular space, we have neurovascular bundle, whereas in upper triangular space we have only vascular structure. Now the question will be framed in such a way that which of the following structures does not have neurovascular bundles in it? So they will give three options, and fourth option may be another one, another space which is written in the body, and you have to select for this upper triangular space, because no nerves will pass through this upper triangular space. So as of now we had discussed first the skin in the scapular region, thereafter the axio-appendicular muscles, what is the first layer, what is the second layer, and in the scapulohumeral muscles we had discussed the different muscles, and what are the spaces that are present in these muscles called as intermuscular spaces also we had discussed, and which muscles will form around the shoulder joint as a rotator cuff also we had discussed. This is what we had discussed till now. Now we will be shifting to the top, the movements of scapula. How these muscles affect the movement of scapula. That is the next one. Next topic is regarding the movements of scapula. So in the movements of scapula, what are the movements? First actually is, one is protraction, where the forward movement of the scapula is there. Another is retraction, where the backward movement of scapula is there. Forward movement of scapula, whereas retraction is backward movement of the scapula. Elevation, rising of the scapula above. Rising the scapula above is called as elevation. Next is depression. What is depression? Is the movement of scapula downwards. Scapular movements downwards is called as depression. And there even rotations are possible. One is a medial rotation and another is a lateral rotation. And usually people confuse here that why it is medial rotation, why is lateral rotation. Medial rotation is the one where is based upon what is the movement towards the inferior angle. What is the movement of this inferior angle towards which side? For example, if the inferior angle is moved towards the medial side, that's a medial rotation. And if inferior angle is moved towards the right side, that's a lateral rotation. That's a cheat code for understanding what is medial and lateral rotation. Okay, actually the rotation is taking place through an axis. What is that axis is? The axis passes through the spine of the scapula, central part, the central spine of the scapula on the posterior side to sternoclavicular joint on the same side. Sternoclavicular joint on same side. That means for the rotation there must be some axis around where it is going. So one point will be passing at the center of the spine of scapula on the posterior side, and that will be extending anteriorly the imaginary line through the sternoclavicular joint. So through that axis, the movements, either the medial rotation or the lateral rotation usually occurs. Okay, so medial rotation where inferior angle moves towards the medial side, whereas if the same inferior angle moves towards the lateral side, that is called as lateral rotation. That's it. Okay, so these are the movements of the different movements that are present in the scapula. Now, which muscles helps in these movements? That's the major question. First, we will discuss about this set, then the second set, and finally the third set. Okay, first, protraction and retraction. This is the scapula on the front view where we have the coracoid process projection and a notch here. Now, along the medial border, there is a pull of a muscle. This is a medial border and this is the lateral border. Okay, and on the medial side, there is a pull of the muscle called as a serratus anterior. That is towards the pull on the lateral, pushing towards the lateral side, towards forwards only, but forward laterally. But forwards and medially, the direction is pulled by another muscle which is present, which is inserting over the coracoid process, that is called as pectoralis minor. So pectoralis minor is forwards and medially, whereas serratus anterior is forwards and laterally. The effect is coming towards the front side. That front movement of the scapula is called as protraction. So protraction muscles, which are the muscles helps in protraction, is serratus anterior and also the pectoralis minor. Next, if you see from the posterior view, how about the retraction? The retraction is by, here we have the muscles called as rhomboides minor and rhomboides major, and this spinous process will be continuing as the acromion process, and over the acromion process we have the fibers are inserting, and what are those fibers are inserting is the middle fibers of trapezius. Okay, that causes the backward pull. So the backward pull is by the middle fibers of trapezius, rhomboides minor and the rhomboides major. These muscles helps in the backward pull of these scapula, that is called as a retraction. So protraction is by serratus anterior and also the pectoralis minor, whereas retraction is by, on the medial side the pull is by the rhomboides major and minor, and on the lateral side the pull is by, that means backward pull only, by the middle fibers of trapezius. This is the protraction and retraction muscles. This is the first set of movement, the protraction and retraction. The second set of movement is elevation and depression. Again, the posterior view of the scapula. Which fibers will cause elevation is, this is spinous projection with the acromion process on the clavicular fibers which is attaching here. And from the clavicular fibers, the trapezius fibers are present, upper fibers, and these upper fibers will cause a contraction from the lateral side above. So it is the upper fibers of trapezius from the lateral side. Whereas on the medial side, the upward pull is by the levator scapulae. So that's the elevation. Now what about the depression? Again, the same diagram, the posterior view, which is showing the features of the scapula. And the depression is by, and this is the spinous process with acromion process. Here the fibers which are inserting on the upper border of the spinous process, the fibers are coming from the downwards. They are the trapezius. So the pull will be by the lower fibers of trapezius. On the medial side, and from the angle of the scapula also there is a downward pull, that is by the latissimus dorsi, and finally due to the gravity also there is an action. So we have the upper limb here, and upper limb due to gravity also it causes the shoulder joint to come down. That means shoulder joint come down means the scapula is also attaching with it, so scapula also comes down. So it's the weight of upper limb. It's the weight of upper limb. See, we can say that simply the gravity effects. Due to the gravity, the weight of the upper limb will be causing the scapula to come down. That is called as the depression. So this is another set of movement. So protraction, retraction is completed, elevation, depression is completed. Now what about the medial and lateral rotation? And what is the axis we had already discussed. And what is about the muscles is, for this medial rotation, where is the inferior angle has to turn? It has to turn towards the medial side. So let's discuss first about the medial rotation. So for this medial rotation, which fibers are helping? Is here, this is a spinous projection with this acromion process. So for this medial rotation, the muscles helping are, one is by the rhomboides minor, the rhomboides major, and also the levator scapulae. Levator scapulae, rhomboides minor, and the rhomboides major. This causes the pull towards the upwards and medially. So that's why there is an inferior angle is turning towards the medial side, that called as medial rotation. That's on the medial side action. But what about the lateral side action is by the weight of upper limb again. Weight of upper limb on the lateral sides. This weight of upper limb is partially acting as the rotation. Okay. So rotation is by the three muscles on the medial side and also the weight of the upper limb on the lateral side. That's a medial rotation. Now what about the lateral rotation is, the lateral rotation here is a spinous process projection and here is a clavicle. In this here the lower fibers of trapezius will be dragged downwards, whereas upper fibers of trapezius will be dragged on this side. Whereas the serratus anterior, which is present on the ventral side, will pull towards the front side. So this all makes to rotate in this manner. So that is called where the medial border, the inferior angle of the scapula is turning towards the lateral side like this. So that is called as a lateral rotation. So for this lateral rotation, what are the muscles helping is, one is the upper fibers of the trapezius, trapezius fibers, and here is the lower trapezius fibers which is dragging downwards, and this is the serratus anterior lower part, serratus anterior lower fibers, which causes the pull towards the lateral side and also forwards. So that makes the effect to turn to the inferior angle to turn on the lateral side. That is called as the lateral rotation. Okay, so these are all the movements that are present in case of scapula.